Welcome to episode 18 of the Pregactive podcast as we talk with Dr. Susanna, obstetrician gynecologist, all about the 6-week check postpartum. This is so important for pregnant women and new mothers to listen to because there is a discrepancy in the quality of care that women receive postpartum. Through the system, it's ensuring that you go in with confidence, knowing what you can ask and what you should expect of the 6-week check postpartum. Hi, I'm Karen, the founder of Pregactive, and through this Pregactive podcast, I'm going to help you to feel empowered, informed, and confident through your pregnancy and postpartum journey as we talk all things health, mind, and fitness. Okay, very excited to have Dr. Susanna here with us talking about the postpartum 6-week check because so many women go into that not really even knowing what to expect. And so we're very fortunate to have Dr. Susanna. So before we begin, if you could just give us a bit of a brief, a bit of an intro into who you are and what you do.
Hi, everyone. Thank you very much for inviting me to speak with you today on the postnatal, which is, I find it after delivery, that is one of the most important appointments. I'm Susanna, and my background is Macedonian, and that's why I have very, very multicultural, being obviously a woman and I speak few languages, so I have lots of women from different backgrounds and religions. So I'm really, really honored to look after all those women. I'm in the obstetrics and gynecology since 1995, but in the private practice, I just started my 17th year, and I love it. My passion is obstetrics and looking after pregnant women.
Amazing. And that's so important, isn't it? That passion. I think it's so good to have somebody who loves it. So in terms of the 6-week check, give us a bit of a brief as to if somebody came to you, what do you go through?
For all my moms that I deliver, I definitely encourage them to come at 6 weeks, because many of them can hear from their friends, relatives, oh, you don't really need to go for 6 weeks. You can go to the GP. But for me, that's the end of that pregnancy. And first of all, I'm very excited to see the babies that I delivered and have a hold and hug them. And all of them are so cute. But also I need to focus on mom. What is important? Important is for us to discuss how the delivery went. It could be a completely beautiful experience with no issues, but it could have been very traumatic birth. And I just want them to understand what went, even though after each delivery, when I go and see them, when I do my ward rounds following day, I always discuss the delivery to get them to understand, especially if it was something more complex and I had to organize I had to do either instrumental delivery or help them with a vacuum or had to do emergency cesarean section. When I go to the room following day, I always explain to them what went through. However, they're all overwhelmed. They need to learn how to breastfeed. They need to, then the physio comes, then the midwife comes, and they're checked or they're being checked on everything. So they may forget all that. And then that's why it's so important. And I get my staff to definitely email and encourage them to all come at their postnatal visit. Why? First, we need to debrief if there is anything. Even if it's a positive experience, that's still debriefing and going through those emotions. Number 2, I need to check if they had cesarean section scar. I want to check how the scar is healing. However, that doesn't mean that in those 6 weeks, if there is any issues, I encourage everybody, please contact me and call me. Don't call me like at 5, 6 o'clock at night. If you think there is a problem, call me as soon as possible as you think there is a problem, because sometimes it's better to assess things earlier. Sometimes we don't have enough resources at night if someone, for example, develops mastitis or urinary tract infection or endometritis, which is one of the possible complications of any birth. Also, I go through how is their bladder, bell. If someone had, for example, third-degree tear, fourth-degree tear, I need to check how I do physical examination on the pelvic floor, check how the pelvic strength is. If they need cervical screening tests, if they're overdue or they need repeat, I do that at the time. We go through, I double check what's happening with the breastfeeding. Are they happy? Is the milk supply good? If do I need to send them to see a lactation consultant if they haven't seen anyone? So it covers a lot. Then, of course, we talk about contraception, sexuality, because many women until this point, they're afraid, especially the husbands. That's usually the husband's question. If they're not in person, they usually get their wives to ask, is it okay to start having intercourse? With do you want me to go through each issues?
We'll definitely break it back up. Just keep going as you are.
So it is quite a long visit, so it's not just come in and out. And the very important that we're doing now over the last at least time flies. I think it's good 2-3 years now that we do mental health assessment. So the mental health assessment is very important, and we are trying to establish if anyone has issues in the pregnancy. So normally we check the depressions. We check for if there's any incidents that someone is depressed. At about 28 to 30 weeks when we have questionnaire when they ask them, and depending on the score, then I also have perinatal psychologists in my rooms that she can attend, and it's from me. When the referral is done from me, Anna sees them very quickly, so it is nice to have that emotional support, tips, and how to carry on, and what they need to be, what are their needs, emotional needs that we need to address. With COVID, you can understand it's much more stressful, as we all have that mental stress of the unknown, because it's something new that we are not going. We haven't had this before. Pandemia is not. It's only once in a century. So, and we're unfortunate to say that in our lifetime now we have to deal with that as well, and vaccination and all those questions that are still unknown, even though we still have plenty of experience, but for the everyday person it's not very common that what they are going through. And at the end, of course, I discuss contraception, future pregnancies, and depending what I found at the delivery, if someone had very traumatic delivery, I definitely discuss with them, how would you feel if you have another vaginal birth, and what I want to see, how is their experience. And then, of course, when they come back for the second pregnancy, I always go back to the delivery. If someone had emergency cesarean section, then we go through the risk and complications for vaginal birth, and if they are suitable for vaginal birth after cesarean section, which I'm very, very happy to encourage women to do so.
Amazing.
It is a
And
long.
you know what? This is where I do get frustrated when women say, at my 6-week check, I wasn't checked. There was nothing talked about with me. And I think it's so important that we go through this. And I'll be detailing all of what you've just said in the show notes so that it's easy for women to absorb. But talking about the birth, I think that's really important because it does have a big impact on that postpartum recovery, and mentally and physically, and to also be able to debrief through it. I agree with you about the overwhelm. I remember, I had a 3B tear myself, and I remember the doctor coming in and saying all of these things, and I was like, whoa, I've just had a baby. Like, it does seem a lot at that point. So to be able to go and have that debrief once you sort of soaked it all in and realized what happened. Now you've got a baby and
Yeah,
everything else is under control. So I guess that would be a really good conversation point for you, isn't it?
absolutely.
Yeah. And leading into that, the mental health. Now, you've mentioned that the mental health questionnaires and part of the postpartum check is actually compulsory for all healthcare
Absolutely.
professionals.
Yes, it is. Yeah, definitely. You have to do it. There's no doubt about it. So there is a program called iCare. So that is I forgot who is the name of the psychologist that is is the organizer of that program. But at the moment, because I'm quite happy to do it, I haven't organized for them to do my mental health care plan. But other practices, when they have more doctors, they're using that program.
Yeah, great.
And
And that's the
they channel them in the but because I'm lucky that I have perinatal psychologists in my room, so I find that I like to ask those questions, so I feel confident and comfortable to ask those questions. And of course, if I notice that something is in the pregnancies, how do you feel, because I always ask how they feel and if there is any issues. If they see something, I don't wait until 28 weeks to do the mental health care plan. I just act on it sooner.
And that's important, isn't it? Yeah, to have it both in the pregnancy and then postpartum, that
Both
it's just
ways,
a
definitely, because
part of.
for many people it's overwhelming, especially for the women that are here, because I see lots of women from different backgrounds, and some are not supported, some are here from like on student visas, some here on working visas and don't have their family support, so they don't have their village to help them. And I was one of them almost 30 years ago, and 28 years ago I had no family, so it was just me and my husband, and it was not easy after emergency cesarean section to do all those things that I tell my mums not to do: cooking, cleaning. My husband had to go back to work at the time, so he could not stay home and help me. But you know what? I didn't find that difficult. It was just nostalgia that I didn't have my family, but I was just over the moon to be myself and my baby and everything. So to be honest, maybe it's my personality. I just did not. It was not easy, but I was just happy, very happy.
Which is so good and so beautiful. You know, I speak to my 90-year-old grandmother who had 6 children, and she had 4 under the age of 5. And she's the same. She's like, it was great. I loved them. And, you know, she did everything and just surrendered almost to that motherhood. Whereas in today's society, there is this weird pressure to keep up with everything, and you know, the social media and the, you know, everything, and try to be everything and to everybody. And I think a big part of that acceptance postpartum is actually going, just be the mother to this beautiful baby and just look after yourself, and that's okay.
I was just about to say the same thing. That's what I want. If one thing women that will listen to this podcast remember, is that we've all been through that. It's not easy. Learning to breastfeed, bloody difficult in the first 10 days. But after that, oh my God, it's the easiest thing. So just put some effort into it. It is, as we say, no pain, no gain. But you gain no bottles, no sterilizing. If you have good milk supply and your baby sucks well, no problem. It's beautiful feeling. And I felt rejected when they all of a sudden they win themselves. It was the worst feeling, and you feel, oh my God, I just, because you feel that bonding. And women have too much expectations. They have too much pressure from, as you mentioned yourself, social media, their friends. Doesn't mean that their friends really went that easy. But some people forget what they went through. So I say to all of them, I went through the same. I was a doctor, but I was not obstetrician when I had my babies. I was not pediatrician. So there were always some things that I was not happy. But you ask your mom, you ask your mother-in-law, and few close friends, and and you just learn yourself every day more and more. Just love your baby and don't pressure yourself, and everything will be much easier.
And that's so important as well, I think, is those resources. Don't be afraid to ask questions. But when it comes to asking questions, it's really important to ask the right people, because if you get the wrong opinion, then it can be really difficult. I know there's obviously a lot of pressure in those first few weeks for women in terms of breastfeeding, and it can be too much, and obviously the stress increase doesn't help the process. So just if they need to, like you said, Cool. Ask your healthcare professional because it's really, really important. Yeah.
And we do, even my staff and myself, we are, when they leave hospital, as I mentioned before, I say to them, don't hesitate to call if they have any questions, even if you think it's very silly question. And then they'll leave a message with my girls if I'm with a patient or I'm at delivery. And then at the end of the day, or when I'm between patients, I'll give them a quick call. Reassurance is so important, especially
Mm.
for first-time moms, even second-time moms. Sometimes you get second-time moms, they say, oh God, my God, I don't remember anything. It wasn't like this the first baby. Probably it was
Don't
much
tell
the
me
same.
that.
Probably it was much the same the first baby, but they just they suppress that memory, and it's because it wasn't important, and then here it comes again. Breastfeeding
Yeah.
is very important if they are happy to breastfeed. And another thing is I don't want them to be pressured that they must breastfeed if things are not right. Um, I remember a few patients of mine that had such a bad mastitis that they even took a while to fall pregnant for the second baby because the memory of being in hospital, IV antibiotics, that
Mm.
temperature, that pain, and or someone that if they had abscess, thank God that's not very often as well.
Yeah. And it just goes back to show that whole debrief and releasing some of that
Very important.
tension and trauma is really important as well. Yeah. So in terms of wound healing, particularly, well, C-section wounds, but also tears are really a worry for a lot of moms, and getting that checked is really important in the 6-week check, isn't it?
Yeah, absolutely. And if they have any issues, any worries, again, when they call, I ask them, because sometimes it's not easy, especially in COVID situation. I get them to take a photo of the wound, send them through my email, and I have a look, and then I call them and I'll say, what is your worry? I see your wound. It doesn't look red, doesn't look infected. So sometimes it's, as you know, obesity is a big issue in our society. So many times you have a woman that her BMI is higher. So when you have more fat tissue, that is more prone to get infected. Emergency cesarean section that can have increased risk for wound infection. So that's why we give antibiotics. We do give routinely, but if someone had long labor, they are febrile at delivery, so I sometimes give them longer or a couple of doses or 3 doses in 24 hours. But I tell them a wound care is very important. These days we have the dressing that sits on the wound. It is protective, so I ask them to remove it in 2 weeks. But if there is any issues, I get them to come if I need to change the dressing, if they have lots of oozing. So I just double check and see if they need any like antibiotic treatment. I'm not very, very fast to give them antibiotics if they don't need it, because there is no point of giving something if there is no urinary tract infection can be common. Endometritis can happen in the first fortnight if there is a little bit of retained membrane or just the germs that are the normal vaginal flora, or if someone had group B strep or ureaplasma or different germs that live in the vagina can cause endometritis. But that's why I want them to call me so I know the symptoms. Many times they don't want to bother me because I deliver them, so they're not coming. Then all of a sudden I'll hear from the GP that will call me to ask me. I said, "Oh, why didn't you come?" Oh, I didn't think I should call you. So doesn't matter how many times sometimes you just don't absorb it what I said.
Yeah, yeah,
And sometimes you
exactly.
feel, how did you not hear? I want you to call me. You're not bothering me. That's my job.
That's so good.
Especially if they had, if someone had traumatic, as you said, you had yourself 3B tear. So I want to see. I want to see what's happening, how it looks, if there is any, like sometimes women get very worried if the stitches fall out. That's fine. They're absorbable stitches, so that you'll notice when you wipe yourself. So, but if there is any smell, if there is any pain or increasing pain that you need more pain relief when you go home than when you were in the hospitals, I'm not happy with that. I want to see her. In that case, she must come.
And so, in terms of that wound, so say let's go back to the C-section wound. You said leave it on for 2 weeks. What is some of the things that you give tips wise to women about keeping their wound, healing and
Just
dry?
keep it nice, clean and dry.
Yeah.
there's some dressings that we can leave up to 4 or 5 weeks, and that I usually use that dressing for women that are of Asian background, or women that are known to have lots of keloid. So sometimes leaving it there, so you have good skin to skin at the cesarean section. If it's the wound looks nice, and that is bacteriostatic, that keeps the wound nice and dry. You can have your showers, and then when you peel it off, the line is really nice. But it is mostly for them not to think about it, that they need to have an extra care, because the dressing, especially the one that I use, Lucomed, is it has gel in it, absorbs all the secretions, so and it's again waterproof, so they don't need to think. So that's not, they don't have that extra, oh, what if something happening with my wound? Nothing is happening. It's skin, it will heal.
Perfect.
And perineum heals very well. And every time we say to women when they go home, when if they had, let's say, second degree, third degree, or even first degree, or few graces that you need to do few stitching, because you just had delivery, immunity is down, you lost some blood. Sometimes there's just the overgrowth of the germs that live in the vagina. Bacteria can cause inflammation in the tissue, because when you push the baby sitting there and traveling through the birth canal, that all of a sudden, all that surrounding tissue in the birth canal, the pelvic floor gets inflamed. So all that needs to heal. So I ask them to have like salt water baths, keep it nice and dry after the shower, not to wipe it, just to dab. Sometimes you can use the hairdryer if you don't feel like dabbing too much with the towel, if it feels very sensitive, because it can.
That's a really good point
And
too. I
sometimes they
actually,
do, and sometimes they do have um, uh, lots of bruising from like some vessels burst inside, so they have this bruising when you see on the perineum. So it doesn't look good, but usually heals within 10 days, 2 weeks.
exactly that. All those points are so important, and I actually got my husband to go out and get some salt because we didn't have salt in the house, or lots of it. We had a little thing, but yeah, that was one thing I didn't know going into postpartum, particularly having my tear, that salt baths were really important, and like those tips are really, really helpful in helping to reduce the issues later in with the wounds. Yeah,
In some
perfect.
cultures, believe or not, they do that routinely. Like Arabic women, they do the salt baths. I think that's cultural, because they tell me that. Yeah, some of the now with the COVID, many of them have gone back, because I have lots of Saudi Arabian students here, or wives of the students that I delivered, and they definitely do it.
Yeah. Do you do warm bath or cold bath?
Warm,
What? Warm. Yeah.
yeah,
Okay.
lukewarm, not too hot,
Not too
not
hot,
yeah,
not
put
too
them to
hot,
cool.
not too cold.
Yeah.
Yeah, good. Now, another thing to remember for the woman going into this 6 week check is obviously you go through so much, but also there are things that you may refer on. And diastasis recti, which is abdominal separation, that is something that if the woman's not seeing a doctor that is specialized in checking diastasis recti, it's really important that she also goes and sees a women's health physiotherapist to get that
Absolutely.
check.
Yeah. I do,
Yeah.
but I don't go into details, because we are so lucky here at Freemasons. We have the Fitwise Studio physiotherapists that come. At St. Vincent, they have their own physio, because I work in both hospitals, and they're really good. Every woman is seen by a physio at after delivery, and sometimes I do have a special request, because women that have like traumatic vaginal birth, or they had third degree tear, it's very important they look after their bowels as well, because we don't want them to have constipation, and we don't want them to strain. And there are lots of things we can help them with. So that's why I request physio to see them. Otherwise, for the rest of them, they have physio. They usually check. So I already know if they had what the physio told them. And many times when they come in 6 weeks, they said, "Can you check?" And I just get them to cough. I know how to check, but I usually refer them to a specialist,
And
like for women's health physio,
yeah,
because they're so good
exactly.
in what they do.
And there's so many women, I think that's the thing about pregnancy and birth and postpartum is the unknown. And, a lot of women I talk to, they'll talk about these things like they've got back pain and the protruding belly, the mummy tummy. And I'll
Yes,
say, oh, do you have diastasis recti? Do you have any abdominal separation? And they go, I don't know. And it's this panic, and it's something that is so simple to get diagnosed, and once you do, then you've got a better understanding, because you know
that's
what,
correct.
we only have one body, and looking after your body, particularly when it's gone through so much, is really important, particularly early postpartum, because if it's, oh, I don't know, and I'm too nervous to ask anyone, then months, maybe years down the track is the regret. Is the regret that they didn't ask early on. And yes, there's a lot going on, and your brain's not functioning at optimal because of all the sleep deprivation and all the changes
Yes,
happening. But to prioritize you just a little bit is really, really important. Yeah, we actually have it as a self-diagnose check in our core rehab, because I get tired of women being so unsure, and it's important for them to have that self knowledge, but also then for them to go and see a women's health physio if they have any concerns at all. Really important. Yeah.
that's correct.
And so I'm smiling and laughing because contraception and future pregnancies, it's almost sometimes immediately after birth, it's like, that's not the first thing I'm thinking about. But for some
Yes,
women, it is. For some women, they've
absolutely.
sort of got to
Yes,
plan ahead. Yeah. So
yes.
that's a conversation.
So we go through all methods of contraception. It depends whether they are breastfeeding or not. What is their because you have women that will say, "I don't want to get pregnant." This is or they had 2 or 3 children, and they definitely don't want any unwanted or an unplanned pregnancy. So I definitely discuss with them, because it's very. The fertility comes back. You're breastfeeding, but you can still fall pregnant. So breastfeeding is not contraception. Um, so that's why we discuss if they're breastfeeding, if they're eligible and they have no problem, I can prescribe the mini pill. Sometimes they already had, for example, Mirena IUD, or now we have Kylina IUD. So those are a very good method for contraception, because it's progesterone only and does not interfere with the breastfeeding. If they're not breastfeeding, we can go back on whatever they had. They had, for example, IUD, or they want to go back on the full pill. Some women just are happy to use condoms and like barrier method. Diaphragm here in Australia is not very popular. We don't have many women that use diaphragm. And of course, sometimes you have women that want permanent contraception, like tubal ligation, or the husbands go and undergo vasectomy. However, until the vasectomy is done and you have to have clear no viable sperm in 3 months in the ejaculate, so that means you still need contraception in those coming months. So I always discuss what they were on before. Are they happy to continue with the same method, or do we need to change something? And of course, I have women that have like family history of breast cancer. So we discuss like what is the length of the pill, how long you should be or on it, or should you have an alternative method of contraception.
Amazing. So important to have that knowledge and to go through it, because I do know women who have fallen pregnant pretty quick
Yeah,
after and gone, I didn't plan for this. And yeah, it all just sort of is a lot for them. Some women want that, and that's fine, but it's more about being prepared and knowing what works and what doesn't work. Yeah, I actually got asked the other day, can you get pregnant like the day after you give birth? I'm like, well, I don't think that
not
would even be
really.
possible.
Not that quick. Not that quick, but there have been instances. I don't remember many, but I probably have 1 or 2 that were sort of in very early pregnancy. Their 6 weeks appointment. Yeah, because when
Wow.
you after you deliver, the ovaries start working again.
Oh
So
my
the cycle
goodness.
is getting ready, but not often. In 17 Yes, I know of two that were like either at 7 or 8 weeks they were already conceiving, have conceived a second child because they didn't think they can get pregnant in the first 6 weeks.
Listen up, ladies. It's important information. Wow, that is incredible. That I just am so amazed, and I'm assuming so are you, about the woman's body. It's just the most incredible thing and what it can do. And
Yes,
I think being supported through that pregnancy journey and then birth, but then also this early postpartum journey is really important. And going through, everything that you've just spoke about. Obviously, there's the cervical screening test as well that you do if that's needed, but just giving women the empowerment and the feeling confident as they go into their check. And the other thing to remember is that if they're not seeing, an obstetrician like yourself that's so knowledgeable in this area, if they're going just to their normal GP that may not do these checks very regular, and the GP doesn't cover everything that you have covered, that then they feel confident in booking themselves in with a women's health physio or a women's psychologist or something that gives them that help. Because for myself, I know I invested, and I would always invest in myself with treatments and things like that throughout the pregnancy, but particularly later in the pregnancy. And then I had a women's health physio appointment day 3. She came to my house. I had one week 3, week 6, and week 9. And then through the hospital system, because of my 3B tear, I had one at 10 weeks booked. But if I hadn't have booked those other ones, it would have been a 10-week wait until I saw anybody for this tear, apart from just a quick, the 6-week check with a GP. And, you also take a bit of ownership for yourself and reach out. Use the resources. Obviously, the women seeing you have got you as that amazing resource, but those who don't see you, making sure that you're taking a little bit of ownership in making sure you see the healthcare professionals that are going to look
yes,
after you. Yeah.
yes, and or they need to be aware that they exist. So because some people are just some women are just not aware that they're there
Exactly. That's it. Well,
and that they can help.
Thank you so much for your time today, Dr. Susanna. It's so
Okay.
important that we talk through this topic. And as I mentioned, we'll put everything in the show notes so that women feeling overwhelmed now at how much information there was, they can reread it and re-listen to this and, come out of that 6-week check feeling a little bit more confident in their bodies.
Absolutely. Yeah. Thank you very much for having me.
You're welcome. Such incredible information there from Dr. Susanna, and really important to remember that it may not actually be a 6-week check for women. There may be different time frames that this happens, but it's really important to follow up and make sure that around that time that you're having some sort of appointment with a healthcare professional that's going to take that time with you to go over your needs, to check over your body, to debrief with you about how you are. It's such an important part of your recovery, and really important also if you don't feel like you've received that quality information, to seek other opinions, to get another appointment with another healthcare professional. So take all of this on board. Get into your zone with your empowerment. Feel confident in yourself and know that this is an important step in your postpartum recovery. As always, you'll see the show notes over at preactive.com.